Good morning. Good morning, Rockland. Mark Brownstein here from Emerald Medicare. It's so nice to be back here today. I am solo today. I usually have a guest, but I am here today to talk about Medicare and talk about some, I think, important things to share with you during this open enrollment season. It's a season where people are clearly getting phone calls, which is surprising to me. They are also getting a lot of mail and seeing a lot of TV ads. It's overwhelming to most people who either are on Medicare or who aren't on Medicare and feel like, why am I seeing all these ads about Medicare? So I'm here today, again, Emerald Medicare, to help a little bit of understanding of what maybe some choices are. I am local. I am independent. I'm passionate. I have a staff of 4 people. You've heard from my assistant Michelle last time I was here. You've actually heard my assistant Michael, and we have Kerry on board. So we've upped our team. We've increased our staff to handle the activity during open enrollment, and we are really proud of what we do. We help a tremendous number of people throughout the year. I probably speak to about 1,000 people a year, helping educate them on Medicare. I help financial planners. I help CPAs. I am an independent resource for Nyack Hospital, Montefiore, and for Highland Medical Offices. Recently met with a doctor. I did presentations in front of nurses here in Rockland County. I'm involved in the Rotary and Rivertown Film, in the chambers, in my temple. I'm involved and I educate. And it's important. It's an important subject. And this time of the year, there are so many carriers who are touting their product, their plan, as the best plan ever, and the plan that you should switch to. And the truth is only 1 in 10 people actually switch their plans during this open enrollment time. The open enrollment period is October 15th through December 7th. So any decision about a change needs to happen before December 7th, but its effective date is January 1st. So, a lot of activity in a short amount of time, a lot of thinking, a lot of decisions, a lot of evaluation. But the carriers are truly trying to improve their products. And they're getting the demand from the members to improve their products on a yearly basis. And it's helpful to know that they are improving their products, but from our perspective, it's important for us to help you find the right plan based on your doctors and your medications. That's often what drives this decision. So for those of you who are out there, I don't know how many of you are already 65 or are turning 65 soon. How many of you are retiring soon or are already retired? How many of you have Part A only? How many of you have Part A and Part B? And that's all you have is those two, A and B. And really, what coverage do you have now? Do you have coverage through your spouse? Do you have coverage through the exchange through a subsidy? Do you have Medicare Advantage? Do you have Medicare Supplement? Do you have veteran coverage? All of these kinds of questions are the kinds of questions that I try to assess in a phone call when I'm speaking to people in person or in any capacity. It is so important to really know that the person on the other end of this conversation is looking out for your best interests. And that's really what we do. That's what our company does. There are so many choices out there. Even in a household, 2 people might have completely different doctors and, of course, completely different medications. So it could wind up that 2 people wind up with 2 different plans. The beauty of New York State when it comes to Medicare is that when someone is on a Med Advantage plan, also considered Parts C and D, they can switch to a supplemental plan, also called Medigap, without any health questions, any underwriting, and any pre-existing conditions. That is only the case in 4 states around the country: New York, Connecticut, Massachusetts, and Maine. So there are many states that I work in. I work in 15 different states around the country. There are many states where someone might start out with a MedAdvantage plan, low premium, where they want to switch to a better plan, a plan that covers more doctors, has more flexibility, less restrictions to network. But they may not always be accepted because of the rules of the state. So New York is a great state in that regard. And so it's important to really know the rules. I was talking to someone yesterday moving to South Carolina, and so we looked at it differently. I had someone who came in to me yesterday from Meals on Wheels that I have spoken to, and they were so nervous in coming to visit with me. I had presented to one of the senior groups. They came in to talk to me, and they left relieved. They left knowing that I was going to help them as if this person was my mother. And I really, truly, and my staff really works from that level of compassion. We care about the people we help, we care about the solution, and we care about getting things done. Too often, people in this marketplace are not always doing what's in the best interest of the client. They might be doing what's in the best interest of the people they work for, which might be a carrier, or they just simply may not have all the certifications for all of the carriers that are in this area or the areas in which they service. Each year, I have to not only take a national exam on Medicare, but for each and every carrier that I can offer to clients, I have to take an individual exam each and every year to be qualified and certified to be able to sell those plans. So I spend a good part of my summer learning about the plans and becoming the best expert I can. But, for us at Emerald Medicare, and again, we have an office in Stony Point, we have an office in Nyack, we're at 18 Liberty Square Mall here in Stony Point, and in Nyack, I'm in 15 North Mill Street, really by the new Nyack Grill and Bar. And so, being able to sort of enjoy the work, support the people that we support is just a part of what we do. My staff is there 10 to 3 every day. I have extended hours for sure, evenings, certainly by appointment, evenings and weekends, especially this time of the year. But generally, I start with a phone call. I have gotten calls from people who have heard our radio ads and heard my show on WRCR. And again, they're grateful. They're grateful for the work that we do and this help that we provide. It's interesting. There's been some talk lately about United Healthcare and Montefiore and Highland Medical. And so that has been something that has been going on since 2017 in this community. And the negotiations between the carrier and the facility has been ongoing. They just made a small change where folks that are on Medicare and Medicaid, otherwise called dual special needs, are now accepted within the, United Healthcare Monty system. But that does not include the MedAdvantage plans yet. And so that's been a significant change that has occurred. And so as time goes on, hopefully things will improve in that area. But there are other carriers. There are other carriers that are offering plans in this area. Clearly, I think we have a question. Please. Hello there. Good morning.
Hi, Mark. How you doing? I just wanted to ask you a question. Do you know when Part B Medicare premium will be announced?
Well, that's a great question. And so the Part B premium is currently $148.50. My understanding is that it is $153 going into 2022. Apparently, it hasn't been announced, but that's the information that I have, is that it is going to be $153, which is actually a reasonable increase in terms of percentages. But yes, that is what I understand is going to be $153 going into 2022.
Right. Okay. Thank you very much. I appreciate it.
You're welcome. Thanks for the question.
Have a good day now.
Thank you. And please do give a call here to WRCR if you do have any questions. This is sort of my time to answer questions as a solo person without a guest here. One thing I wanted to mention here today, a number of things, but one is that on TV you've been seeing or in your mailbox about a Part B payback. And this Part B payback, again, referencing the Part B, which was just asked as a question, it's $148.50 in 2021, and it's expected to be $153 in 2022. But there are some, and I repeat, some plans that offer some Part B payback, and so it could be $35. It could be $45. There's only a few plans that offer that. And so for us, it's about, one, looking at your doctors first. And then if we can find a plan that also has a Part B payback, then sure, that will be something that's going to be important. But there are other things that are also important. There's dental, there's vision, there's gym membership, there's acupuncture, there's transportation, there's meals when you leave a hospital. There are all kinds of benefits that these private carriers offer as a part of the Med Advantage plans. So, yes, it's true that there are Part B payback options within some of the carriers, but what we have found in evaluating the doctors that are available, they're not always that you need to have in your network. They're not always in the network. And so if you're willing to switch your doctors for the sole purpose of getting a small amount of Part B payback, then certainly we will guide you in that area. Most people at this time of their lives are fairly loyal to their doctors, but of course some people are very much driven by certainly some of the dental options. So again, I was talking about United Healthcare, and so that has been a challenge in Rockland County. It's the Montefiore system that has had this occur, but there are plenty of other carriers. There's Aetna, there's Health First, there's Oscar, there's Humana. There's Blue Cross Blue Shield. There's really strong carriers that are really looking to get your business. But when we run the doctors, we can tell you very clearly from our team's effort whether those doctors and facilities that you tend to use and frequent are in that network. So, when we're talking about these plans, there's two parts. We always are looking at your doctors, and we're always looking at your medications. The medication component, and I speak about this in every show, is probably the most important part of people's expenditures through the year. They understand that they have to pay something for medical costs, whether it be a copay or whether it be a premium, whether it be an Advantage plan or a Medigap plan. But the prescription drug side is something that is important and has to be understood, and it is confusing. And it's confusing because there are 4 different stages of pricing that exist within Part D. There's the phase, which is the deductible phase. So let me explain that for a moment. When you have a medication, it's either generic or brand, preferred brand, specialty. The generic medications that are out there are not connected to the deductible. So you can be taking generics all through the year and you would never have to address the deductible. The deductible in 2022 has gone up. That I know for sure. It went up from 2021 for $445 to $480 in 2022. That's, again, a significant increase. But it only applies to those medications that are Tier 3, Tier 4, and Tier 5. You may not know which of those medications that you take are in those tiers, but that's certainly the work that we do. When you have a higher tier medication, the first $480 needs to be paid based on the retail cost of that particular medication. So if a medication is $250, you're paying $250. The second time you pay it, you're only paying $230 to get to that $480. Once you get past that deductible, and again, this takes into account other medications you may be taking, but this is just an example. After you pass the deductible phase, you get into the after deductible phase. And in that case, your medication cost might drop to something around $47, $42. And that will continue until you get into what used to be called the donut hole. And now it's called the coverage gap. And so within that coverage gap, the price, again, will go up a bit. Because it's a combination of your expenditures plus the expenditures of the carrier for that medication. Then there's still another phase. Once you get past a higher amount of your out-of-pocket costs, there's a catastrophic cost phase, and that cost will go down. So there are 4 different potential pricing models for a medication throughout the year. Now, you may not hit the coverage gap, you may not hit catastrophic, but those are the kinds of things that we like to educate people on along through the year so that they have an expectation of what their monthly costs will be. Often the beginning of the year, when people are meeting some kind of a deductible, they see a spike in their costs for that first month. But then there's, again, a leveling off of some sort based on the medications. Again, continuing with the Part D plans, continuing with the insights that we provide. GoodRx is one of the discount cards that are out there. Single Care is another one of the discount cards that are out there. They offer valuable reductions of cost for medications that are higher priced on your Part D plan. So we are always running the GoodRx pricing for people who are looking at higher costs. In some cases, it helps a lot. In some cases, it just makes sense to continue on your Part D plan and sort of go through those phases and see the roller coaster of pricing. In addition, there are grants. This is the time of the year to sort of apply for grants, whether it be in any kind of impairment. MS, leukemia, there's so many different impairments that we see where there are medications that are very expensive, where grant programs, where contacting the pharmaceutical company directly might help with costs going forward into the new year. So this is the time of the year when we are encouraging people to look into that. In addition, there is a program that I always speak of called EPIC. EPIC is a New York State pharmaceutical program that is available for people whose household income as a couple is under $100,000 and as a single person under $75,000. There is a deductible that has to be met for EPIC, but once you meet the deductible in EPIC, based on your income from previous year, it's gross income, then no medication can be greater than $20. Some of you on the air may in fact have EPIC. It's important that you let your pharmacy know that you have EPIC so that they can actually put the medications and the costs that you're spending on medication, attribute it to the EPIC program so that when you actually get to the deductible, you actually get the benefit of the reduced costs. A lot of folks that we speak to aren't being proactive relative to their pharmacy. The other thing that EPIC provides, which is a great additional benefit, is it gives the people an additional chance to change their plan mid-year. So if in fact you have EPIC and for some reason you don't like your Med Advantage plan, maybe you don't even like your Part D plan that you purchased as a standalone, if you have EPIC, you can actually make that change without questions, one additional time every single year that you have EPIC. So the Part D, the prescription drug coverage, critical, important, valuable, insightful, but something that people should understand because we take it seriously. We're probably running hundreds of prescription drug plans as we speak through open enrollment to make sure that people are on the right plan. Again, Mark Brownstein, Emerald Medicare. Our phone number is 845-358-1220. If you have any questions, please call here at WRCR. Happy to answer your question. The work that we do is really about helping people every day. We're a 12-month business. We help literally hundreds of new clients a year And again, I educate about 1,000 folks, but it's CPAs, it's financial planners, it's the medical community, it's it's the community here in Rockland and New Jersey and Connecticut that really need this kind of assistance and really value the fact that I am independent. I am paid by the insurance company. My services are free, so please don't ever hesitate to call. We have a caller. Hello there. Can I help you?
Yes, good morning. If someone is 65 or older, is having a prescription plan required?
Well, the answer is it depends on if they have a plan through the job that they may be working at. And so one of the key issues is always, where is coverage coming from now? If they're working for a company or their spouse is working for a company of greater than 20 employees, then the answer is if that's not the case, so if someone is unemployed, self-employed, or working for a company under 20 employees and one is on Medicare, one should have a Part D plan. And when I say should, if one does not, one can and will be penalized. And so there needs to be a continuity of coverage on the prescription drug side. And so, the penalty isn't large. It's not nearly as large as if one delays Part B, but this is the time of the year, if someone doesn't have Part D, to have one. There are plans, Part D standalone plans, as low as $7.20 a month through a company called SilverScript. There are Part D plans that go up to 15 to 30 and up. But it's really important to look at the prescription drugs that one's on. If one has delayed, one might have a penalty, but one should have it because as years go by, the penalty will just increase. Does that make sense?
Yeah, I get it. Yeah. I mean, I'm talking about for myself, and I'm not currently taking any medications, fortunately.
Okay,
I'm
great.
thankful for that. But, I have a prescription plan in addition to my supplemental plan and Medicare.
Yep.
So I just wasn't sure. My deductible is like, I think you said even before, like $480 or something like that. And so to me, I'm paying every month for this plan. I'm not using it, and even if I have a prescription, it's not going to pay for it. So that's why I was wondering if it's something that I would have to have, where I could just prolong and put off until another time.
Well, again, there will be a penalty if you choose to drop it. On the other hand, you may be on a plan that's more expensive, and you may be able to reduce your monthly cost. But you're right. If you're on no medications, there are people who do decide to drop their prescription drug coverage, save the premium, and then when they finally do go on it, one, they have to go on it only during this time of the year, but also they realize that there might be a penalty attached to it.
Is there like a cut and dry what the penalty is, or is it a percentage or something?
It's between $3 and $4 per year. So again, if you delay it 3 years, you're talking about a $12 additional cost for your Part D plans forever. So that penalty will last with you forever if you actually have a gap of Part D coverage. So it's not something I recommend, but if somebody does it, as long as they understand what the consequences might be, then some people certainly do that.
Well, I do understand it now. Thank you.
You're very welcome. Thank you for your call. Have a great day.
All right. You too. Thank you.
Thank you. So, here we are almost a month away from December 7th. And so my comment to all of those on the air who do have questions and want to call our office is try not to wait till December 7th. Call a little bit before that so we can really help you. But I can tell you, we are constantly helping people at the end of a month. So, as recently as the end of October, we're helping people for the beginning of November. People get nervous. People are talking to friends. People reach out to us, and they are nervous, upset, desperate, anxious, but we've performed many miracles. We helped somebody who didn't have their Medicare card. We had a citizenship issue. We had a marriage license issue. They couldn't get Social Security. They got the state legislator involved. They called the Social Security office. We submitted the application with just their Social Security number because they didn't have a Medicare number. We got the application in. They finally got their Medicare number. They got backdated to November 1st, and they were just thrilled. So, we will go out of our way to get people the kind of plan that they need and the timing that they need. The rules are the rules, and we follow the rules, but we have to know the rules. And so it takes somebody who's been in this business a while to really understand the ins and outs of this business. My comment is I can explain Medicare in 3 minutes or 2 hours, but it's people I understand are inundated and confused, but we do a good job at our company to educate people. One thing I do want to share though is that during the time period which is called open enrollment, OEP, it's a period of January 1st through March 31st, where if you have a Med Advantage plan, you can actually switch to another Med Advantage plan. So if you go to a doctor and the doctor says, I'm sorry, I don't take this coverage, and you call us, we can help you between January 1st and March 31st to actually change your Med Advantage plan. So again, I can't believe how quickly the time has flown here. I cannot believe it. The one thing that I did want to share with you before I stop here today is that the dental coverages and the vision coverages that are being offered by the carriers have improved. There's been a lot of press, a lot of talk from the government that they're going to add dental and vision coverage to original Medicare. That's not happening for 2022. But the carriers, on the Advantage side only, have truly improved their offerings. And so if that's something that's important in conjunction with making sure that your doctors are still in network, it is worth looking at. Again, it's Mark Brownstein, Emerald Medicare. We are in Stony Point. We're in Nyack, emeraldmedicare.com. Last thing, November 9th, 6 p.m., I have a webinar that I am conducting. We have about 25 people registered right now. I just did one 2 weeks ago, about the same number of people. I'm going to be talking about specific plans. And so please call our office, 845-358-1220. Sign up for our November 9th, 6 p.m. Annual enrollment webinar that I will be giving. I love doing this show. I love Rockland. I love what I do. My team is happy to help you. Please don't hesitate to give us a call. Thank you all. Have a great weekend. See you in 2 weeks.